A 16-year-old girl comes to the physician complaining of pelvic pain. She says that she develops crampy lower abdominal pain every 28 days that resolves in a day or two. She states that she has never had a menstrual period. The patient is at the 60th percentile for height, 70th percentile for weight, and has fully developed secondary sexual characteristics. Rectal examination reveals a palpable mass anterior to the rectum. Serum beta HCG is negative. The question is, which of the following is the most likely diagnosis in this patient? If you are one of the smartest people on earth, type the correct choice in the comment box below. Choice A, endometriosis. Choice B, ectopic pregnancy. Choice C, hyperprolactinemia. Choice D, imperforate hymen. Choice E, Kallmann syndrome. Choice F, testicular feminization syndrome. Choice G, Turner syndrome. I'm guessing you did not get the answer right. The correct choice is D, which is imperforate hymen. This patient has fully developed secondary sexual characteristics. Therefore, she likely has normal levels of estrogens and gonadotropins. Absent menses in the context of normal ovarian and anterior pituitary gland function is termed eugonadotropic amenorrhea. The two most frequent causes are incomplete canalization of the vaginal plate or Mullerian duct anomalies. The former results in blockage of the vaginal opening and of the lower vagina to imperforate hymen. An imperforate hymen is one of the most common obstructive lesions of the female genital tract. At birth, vaginal secretions stimulated by the mother's estrogen level can cause mucocopose, accumulation of mucus in the vaginal canal, which may manifest as a bulging introitus. If the diagnosis is not made then, the mucus will be reabsorbed and the child will be asymptomatic until menarche. At that time, the patient may present with a history of cyclic pelvic pain. Hematoculpose accumulation of blood in the vaginal canal may lead to marked distension of the vagina, which can also cause back pain and difficulties with defecation and urination. On examination, hematoculpose manifests as a vaginal bulge and/or mass palpated anterior to the rectum. Now, let's see why you were wrong. Choice A is incorrect because endometriosis is the presence of endometrial glands and stroma outside the uterus. It may be asymptomatic or present with severe dysmenorrhea, dyspareunia, and infertility. Choice B is wrong because ectopic pregnancy occurs when a fertilized ovum implants outside of the uterus. The most common site is the ampulla of the fallopian tube. The main risk factor for ectopic pregnancy is a history of pelvic inflammatory disease. Ectopic pregnancy is unlikely with a negative serum BHCG. Choice C, hyperprolactinemia. Secondary to a pituitary microadenoma will result in infertility, oligo, amenorrhea, galactorrhea, and hypoestrogenemia. Choice E, which is Kallmann syndrome, cannot be an answer because this occurs due to impaired synthesis of gonadotropin-releasing hormone by the hypothalamus. The condition presents with primary amenorrhea, absent secondary sexual characteristics, and an olfactory sensory defect. Choice F also cannot be the answer since patients with testicular feminization syndrome, complete androgen insensitivity, have normal breast development but sparse pubic and axillary hair development. There will be absent Wolffian and Mullerian structures. Choice G cannot be an answer as Turner syndrome, karyotype 45XO, is a common cause of primary amenorrhea. Affected individuals have short stature, webbed neck, shielded chest, and fibrotic ovaries. They do not develop secondary sexual characteristics. If you already knew the answer, or at least now know the correct one, click the like button.